So there are really two major different types of strokes. Because these are sudden neurologic deficits because of the blood vessels could either stop carrying the glucose or oxygen the brain needs to make its energy, and that's called an ischemic stroke. That's the most common, where a person may, without pain, suddenly become weak or numb or unable to talk. The second type, which is less common but much more deadly, is if one of the blood vessels were to break or rupture, and they would actually bleed into their brain. That could be painful, it could be devastating, even to loss of life, and it may also be associated with loss of function of an arm or leg.
And how are they treated?
Both types of stroke are treated differently. The more common, the ischemic stroke, is treated by trying to figure out what processes will block a blood vessel and how do we dissolve that or keep that from happening. So we treat it by treating blood pressure, we treat it by treating cholesterol and sugar, which is why diabetes is so important to be treated, and we treat it by trying to dissolve the blood clots with drugs or with catheters, and then we can do that to prevent or to reverse it in action. A bleeding stroke is usually treated by surgery. People have to go in, like myself, and stop the bleeding.